Hi everyone, this is Dr. Stefan. Welcome to Interstitial Lung Disease Info. In this episode, I'd like to discuss about what is supportive care in pulmonary fibrosis for patients who suffer with lung scarring, especially when it is progressive. So when the scars on the lungs do get worse over time. And this is something that's really important also because I did mention in a previous video that only about 1% of patients with pulmonary fibrosis take part in clinical research, which is very, very little. So obviously there's a lot of unknowns, and we cannot say at this stage in 2023 that there is a cure for pulmonary fibrosis. There are treatments that slow down the progress, especially if it's a progressive condition, or in some cases we may be able to stabilize if we have a known cause for the pulmonary fibrosis, the lung scarring, and we either remove the cause or we treat an underlying condition that leads to this pulmonary fibrosis, or if it's an occupational lung disease that's triggering the fibrosis, it may or may not be progressive. If it's a scar related to a previous infection, again, may not be progressive. So there are a lot of circumstances in which people may develop lung scarring. However, when we talk about pulmonary fibrosis, sometimes we do talk about conditions in which this progresses, so it gets worse over time. And in those situations is where we most need supportive care. If we cannot fix that problem and people are getting worse, we need to think about what else can we do. So I have another video about what more can you do about if you are suffering with pulmonary fibrosis besides treatment. I do urge you to look at that one because I cover a lot of lifestyle changes and things that may help. And I think it's probably a good idea to start from there. So I'll leave a link in the description to that video if you want to hear it. And let's talk a little bit about other supportive care measures so that you're aware that they exist. So these form part of the treatment for pulmonary fibrosis. It's not just the medication, it's other things as well. So things like oxygen assessment. Going for an oxygen assessment can be really, really helpful. Now, you may think of oxygen as a terminal illness treatment, something that you use for breathlessness. Actually, it's not the case. So in most situations, we use oxygen based on a prescription that is related to how low your oxygen levels are in your blood. So it's not only what you get off the finger probe, it's what the actual blood levels of oxygen are. And if there is a decrease in your lung capacity to bring oxygen to your body, that's when we may need to consider supplementary oxygen or extra oxygen given through a little cannula, most often, which can be linked to a concentrator or a small tube that can be portable in some cases. So it may not have such an impact on your life. But the good thing about going on oxygen, if you really need it, is that it corrects these blood oxygen levels and your heart doesn't struggle as much, your muscles don't struggle as much to have effective metabolisms. Because when your body is starved of oxygen, you go into anaerobic metabolisms. So that leads to a lactic acid buildup. You're not able to exercise as much. Your heart is struggling a bit more. You are at a higher risk of developing a secondary condition called pulmonary hypertension, which is basically when the pressure between the heart and the lungs increases in that artery, and that can lead to severe breathlessness. So just having the extra oxygen, if you'd need it, may actually help a lot to prevent complications. It doesn't work to prevent breathlessness. In many people, it's not having as much of an effect on breathlessness because breathlessness is a sensation that's very subjective. So it can be linked to a lot of other things. But actually, if you do need oxygen, it's a good idea to just check first. So in many cases, your physician will ask you to go for a walk test. So basically, this is the first step where they ask you to walk around with an oxygen probe, see if your oxygen levels dip. And if that's the case, they may go further and test your blood. They may give you a little bit of oxygen to see what level you would require to correct the levels. So this is usually how it's assessed. That's an ambulatory oxygen assessment. In some cases, though, in more advanced situations, you may actually need long-term oxygen. This is oxygen provided on a more continuous basis. But oxygen treatment and oxygen assessments, going to just check, because not everyone will need oxygen with pulmonary fibrosis, it's really important to consider. It's part of the supportive care. The second thing is pulmonary rehabilitation. So pulmonary rehabilitation basically sounds a little bit odd when you think about it. And just like in the case of oxygen, it sounds a little bit terminal when you think about rehabilitation. These words, to be honest, I haven't picked them. This is just how these things are called. So, oxygen therapy, pulmonary rehabilitation. So as long as you can get past the psychological blockages associated with these words, and I do know that those exist, these can be really helpful. So Pulmonary rehabilitation just means exercise for the lungs. So this is basically when you're using certain types of exercise to strengthen the respiratory muscles. And this can be tailored based on your needs. So this is why it's a program, it's a formal program usually run by physiotherapists who will guide you depending on what your needs are. So, for example, you may be quite significantly impaired because of your pulmonary fibrosis or other health problems. Maybe you're having some joint disease, you're struggling to walk around, you have issues with stability. So they may teach you exercises that you can use depending on your own circumstances. And also, if you have a family member, if it's not yourself who's suffering with pulmonary fibrosis or these problems, maybe there's a family member, someone you care about, do encourage them to stay active, to go to these programs of pulmonary rehabilitation if they're available in the area where you live, because they can be really helpful to break the cycle of getting progressively more breathless, doing less and less, which weakens the muscles, which leads to more breathlessness. So that's really, really important. The other thing, the third thing that is part of supportive care, in my opinion, is to treat comorbidities. So to treat other associated conditions in addition to pulmonary fibrosis. And if you think about it, someone who suffers with pulmonary fibrosis will maybe be a little bit older, so they may have other conditions such as high blood pressure, diabetes, kidney disease, heart disease. Being on the right medication for these conditions is really important because it will help your body operate in optimal ways. So sometimes it may not only be your pulmonary fibrosis that's causing the breathlessness, but it may be a heart condition that's maybe a bit of heart failure that requires specific treatment. And that may get rid of some of the breathlessness. So going to treat comorbidities is really important. And sometimes, if you think about diabetes as well, sometimes going on treatments such as metformin has been linked to some improvements in maybe things related to aging, genetics. This is another topic that maybe we get into another video, but there is some preliminary good news that there may be some treatments which may impact on pulmonary fibrosis, even though there are not medications directly for pulmonary fibrosis. So this is something that I will try to explore in future videos as the science gets more refined. There are actually some research projects that are in the works now, that are in the making, to try to determine which treatments are the best for the associated conditions for patients with pulmonary fibrosis. Because it's really, really interesting, because it appears that some medications, maybe metformin, maybe certain high blood pressure medications, may actually help in the treatment. So together with maybe anti-fibrotic, anti-scarring medication, they may actually help. So this is really interesting. The other thing related to supportive care that I'd like to talk about is the role of the specialist nurse. Now, it depends where you are in the world, what's the setup for the health system in your country. But in many parts of the world, there is this move to not only be treated by a doctor. And I think that's fantastic because, to be honest, as doctors, we sometimes get overwhelmed. We have very little time to spend with patients, and it can be difficult to actually explain things in detail. I struggle as well with this, with consultations that are sometimes 20 minutes. So in 20 minutes, there's not much you can do in terms of explanations. Unfortunately, you just deal with the day-to-day prescriptions, checking blood test results, etc. But it's usually not enough. So having access to a specialist nurse is sometimes a good thing. So basically, this is a nurse who is trained to deal with patients with pulmonary fibrosis, to manage symptoms, to discuss. Sometimes they can actually prescribe medication. So it's a role that's becoming more and more advanced. And it's really, really important because nurses may sometimes have a bit more time, a bit more dedication to explaining things in an empathetic way. So it's a great thing to have access to a discussion with a specialist nurse to manage symptoms, to manage side effects of medications and things like that. So really, if you do have access to a specialist nurse, do try to seek their advice. It's really, really important. The other thing would be to discuss about symptom treatment. So basically, if you are suffering with pulmonary fibrosis, you may struggle with breathlessness, with cough. There may be treatments available in your case that may reduce these problems that are these features of pulmonary fibrosis as a condition. So for example, if you're struggling with a significant breathlessness, this may not be treated necessarily with oxygen, but sometimes maybe you will be prescribed a low dose of morphine. And this can actually sometimes help with dealing with the breathlessness because it's a subjective condition. It's not morphine in the sense of drugging you out or making you sleepy or, palliating your symptoms or stuff like that. So sometimes low doses of morphine can actually help you feel less breathless. So that can be really useful. Also, morphine can help with the cough in some regards. There may also be other medication for the cough, or there may be other triggers for your cough that are not related to pulmonary fibrosis, and it's important to explore these with your doctor. For example, if you're suffering with acid reflux from your stomach, maybe that requires treatment because it may be worsening your cough. If you're having postnasal drip, which is basically secretions running down the back of your throat, irritating the back of your airway passages, that may trigger a cough and may be treated with a nasal spray or something that your doctor may recommend in your case. If you are suffering with asthma or COPD, maybe going on certain inhalers may help you deal with the coughing that's associated with pulmonary fibrosis. So again, these things should be discussed. They are part of supportive care. The final thing I'd like to mention here is also the role of palliative care. So when we talk about palliative care, many people, again, for psychological reasons, for obvious reasons, they may associate it with end of life. There's nothing left to do, so we go on palliative care. It's not necessarily the case. So palliative care just basically means that there will be a specialist potentially that you may be seeing, or you may be admitted to a certain hospice or another facility where actually your entire health will be assessed. So basically that's the point of palliative care, to see where we can intervene to minimize the treatments that you are on in order to improve your quality of life, or for example to implement some of the changes that I mentioned before. So for example, treating symptoms, treating side effects of medications better, maybe providing you with more intensive rehabilitation programs to help you cope better with your symptoms. So basically it's an intervention, palliative care, in order to increase your quality of life in severe cases of pulmonary fibrosis. So I would urge people to maybe not consider this as something that's terminal, that there's no coming back from palliative care, from these discussions. I think it's important to just consider that it may be helpful to see a specialist who can handle the complexities of your condition. So your pulmonologist, the person who you're seeing for your respiratory problem, may be prescribing treatments for specific things that I mentioned before, but maybe the palliative care expert will be able to have a more holistic approach related to your other medications, to treating other conditions, maybe reducing some of the many medications that you may be having that may be causing interactions and things like that. This is where a specialist pharmacist may be useful to see as well. So there are interstitial lung disease pharmacists as well, just like there are specialist nurses for interstitial lung diseases. So the pharmacists may actually help you deal with some of the side effects and interactions of all the medications that you might be dealing with. So it's really important to consider other specialists that you may not traditionally see, or you may not consider that they may be helpful to see in the cases of pulmonary fibrosis or lung condition. But it's important to have a holistic approach to try to deal with the whole body, with the body as a whole, basically. Usually, when people have pulmonary fibrosis, they may have other problems as well. So it's important to try to treat all of them, to support the person in their life, to improve their quality of life, to reduce medications where the benefit is not as expected, or where the side effects are more important than the quality of life benefits. So taking all of this into account plays a role in this supportive care package that hopefully you will be given, you'll have access to. I hope this was helpful to give you an outline of what may happen if you do suffer with pulmonary fibrosis and you may require additional treatments on top of your usual medications to treat the pulmonary fibrosis. So hopefully this was good. If you have further questions, leave them in the comment section below. If you're watching this on YouTube, if you're listening to this as a podcast, I urge you to go to the YouTube channel and drop a comment there, because I will try to see them and it will guide me how I develop the channel further, what new content to create for you. And hopefully it was helpful, like I said before. All the best and good health.